Hello and welcome to your national TV Doordarshan. We are coming to you from the studios here in Didi, Nagaland, and this time we have many questions packed for you and all on the corona vaccines which has been rolled out in India and here in Nagaland as well. For all the healthcare workers and frontline workers in the first phase. While many have been getting the vaccines without doubts and going about their daily routines, there are some who have questions and doubts, and that is normal. But we have here with us Dr. Rupert Peseye in the studio to help us clear our doubts and questions. Doctor, thank you for sparing your time and joining us here in the studio.
Good afternoon, Vincent. It's an honor and pleasure. Firstly, I bring greetings to you from our Chief Medical Officer, Dr. Vizokolo, and our CMO staff, Kohima.
Thank you, Doctor. I know you have been really busy lately. And without further ado, we will get started with our questions now.
Right.
We have many doubts and questions and queries coming. And when I was preparing to have the session with you here in the studio, then there were many friends who were telling me, please ask this question. So we have many. But to begin first, Doctor, what are your thoughts on the COVID-19 vaccination challenges, concerns, and of course, opportunities as well?
Vincent, like last year was a very rough year. So it has affected each one of us in, different capacities. And then every one of us, somehow we were praying for a solution for this pandemic.
Correct.
So the vaccine has come now, and I feel it's a welcome addition to the pandemic. So with the different variants of SARS-CoV-2 virus, which causes COVID-19, the global race has started, to end this pandemic using all different tools. So that has become the goal. So when we talk about the tools of fighting the pandemic, then we can go back to using COVID protocols and then the vaccination.
Correct.
So I just want to stress regarding the COVID protocols, which we all know: wearing masks,
Sure.
washing hands,
Yes.
watching distance, and avoiding crowded places, close contact settings, constrained spaces. Those are to be avoided. As far as vaccination is concerned, vaccination, I feel like it is the safest way to end this pandemic and reduce the mortality. As we see, millions of people are getting vaccinated all over the world. Even in India, it was launched on 16th
Yes.
here by our Prime Minister. And then our Chief Minister was graceful enough to come to NHK and launch the program there. So we had 100 beneficiaries there, and the turnout was 80. So 80% vaccinated. For the start, it was good.
It is.
So definitely in the dry run, and even when the vaccine was really rolled out on 16, we did have challenges which were addressed to again. And with the new phases coming for introduction of the vaccine, we'll definitely have new challenges. But I do feel CMO and team are well prepared to address to all the issues.
I'm sure it will be, because we have a very dynamic CMO and the person like you to lead the team. So I'm sure it will be. But with so many doubts and questions in mind, we have the temptation to ask again: is the vaccine mandatory? See,
the government of India has clearly stated that the vaccine will be by choice. Now, when we talk about COVID protocols, when we maintain the COVID protocols, COVID protocols will, prevent us from getting exposed to the virus, and the vaccination will protect us when we are exposed to the virus. So the two tools used together will definitely work better. So you and I need to take a call on that, but to protect our loved ones, to protect ourselves and our loved ones with comorbidities, we need to cut the chain of transmission and be a part of this global race to end this pandemic.
Okay. That's well said, and I'm sure all our viewers out there will understand this important message as well. Well, doctor, what age group can get the vaccine? And my curiosity, I guess, how is the vaccine administered? I've seen a lot in WhatsApp and all those things, but that scares me. So you tell me now.
As far as age is concerned, the protocols clearly say that those below 18 years won't be vaccinated for the time. As we get more data, it will be available for those below 18 years also. But for now, those below 18 years won't be given the vaccine.
I see.
That is one. Regarding your concerns, yes, like any other, we respect, everyone will have concerns. But what I feel is, if you ask me why do we need to take the vaccination, like I would say the vaccination will prevent you from getting COVID-19. Now, like any other vaccination under routine immunization program, like once a beneficiary is being vaccinated, the particular vaccine protects the beneficiary from getting seriously ill. Similarly, with COVID-19 vaccine, it will, it will prevent the beneficiary from getting any serious ill effects from the COVID-19 virus.
I see.
Now, the second point I want to stress out here is the vaccine is very safe. The Covishield, which our state government has received, like it has passed through all the clinical trials, all the preclinical trials also, plus all the phases. So I should say that it's a very safe vaccine.
You talked about Covishield being administered here in Nagaland.
Yes, yes.
We hear of Covaxin, getting Covaxin when administered needs to get a consent form, while Covishield, I had a question for later.
Okay.
While Covishield, we are not giving any consent form signed, isn't it?
Vincent, like since the start of pandemic, we can see that many of the companies have been closely working with governmental agencies, the health sector, the partner agencies to develop a vaccine. Now that we have a vaccine, our central government has approved Covaxin and this Covishield. So, see, for a vaccine to be approved, it goes through various, phases, and sometimes it takes decades also. But taking into consideration the pandemic situation and the technological advancements which we have in our table Covaxin and Covishield, which has passed through mostly the preclinical stage and the clinical stage, which is to do about how the vaccine works, then the phase 1, phase 2, how safe is the vaccine, then comes the efficacy, then comes the approval. So Covishield has passed through this, and both Covishield and Covaxin as such has been approved by the government, taking into the results of the clinical trials.
Okay.
Now, when we talk about Covishield is being manufactured by our Serum Institute, like Pune.
Yes.
So, like that is one institute which is the largest producers of vaccine in the world.
Okay.
On the other hand, Covaxin is an indigenous product again by Bharat Biotech Limited, and here the collaborator is again ICMR, which is one of the highest research bodies in India.
Yeah, very respectable.
So as far as the technology is concerned, again, both Covaxin and Covishield has very safe, technology behind.
Okay,
now,
you're saying both Covaxin and Covishield are very safe.
Yes.
Well, that's fine. What vaccine is being administered in Nagaland today? Which of these?
We received Covishield for Nagaland.
We received Covishield.
Yes,
Okay, that's great.
Yes.
So, at what intervals will the COVID-19 vaccine be administered?
So after the first dose is being administered, there will be a gap of 28 days, and thereafter, again the beneficiary will be put up in the portal, and he or she will get the SMS as to the time and the place of the next session.
I can't stop, my curiosity, and like me, all of you out there in the watching this program are, asking yourself, Doctor, apni bhi vaccine loisna loane hudi thaiwa. Wow, how is that?
I'm a very proud recipient of the vaccine,
Okay,
Covishield.
okay.
I received it on 18th at Sikazu UPSC session.
Okay.
Before receiving my vaccine, I got the SMS that, doctor, you are scheduled for vaccination on so and so date on 18 at Sikazu. After I received the vaccination, I got the message saying congratulations. You have been administered the vaccine. So it was a nice feeling being in the global race.
And truly, the warriors who have taken the bold step first. Congratulations, doctor.
Thank you. Thank you.
So, 1 crore health care providers and 2 crore frontline workers are expected to be vaccinated first. Will the vaccination? When do you think the vaccination will begin for the common population, and will the vaccine be free of cost then?
The government of India has prioritized the health workers first, just for the reason that they are of the high risk group, always exposed to COVID-19.
Indeed.
Always in the forefront of the battle.
Yes.
So if health workers are protected, they'll be able to give the essential services properly, and at the same time fight the pandemic. Of course, the next phase will be for the public who are 50 and above.
I see. I see.
And those 50 and below with comorbidities.
Okay.
And those 50 and above will be again divided into 2 groups. That is 50 to 60 years and 60 years above. So it can occur simultaneously depending on the availability of the vaccines. Thereby it will come to the general public. Yeah.
So far it is free.
So far it is free.
Yes.
Free, yes.
So if you are in that age bracket, then it is sooner than you think that you will be able to get the vaccination if your doubts and questions are cleared. And I say it is normal to have doubts and questions, but doctor has given us a very, very important message early in the beginning of this discussion, that if you love your near and dear ones, if you love your senior citizens, your parents who have comorbidities, then your getting the vaccination is going to be very, very vital for their health as well. So keep that in mind. And doctor, when will antibodies against the coronavirus develop after taking the vaccine? Because you have taken on 18.
Yes.
Yeah.
I should say sufficient antibodies to protect a beneficiary who has been vaccinated will take place after 2 weeks from the after receiving the second dose.
Acha. After receiving
2 weeks after receiving the second dose.
That's why you continue to put on your mask
Yes,
and follow all the SOPs.
Yes.
Okay, that's great. So those of you who are out there, lucky people, brave people who have taken the exemplary step in taking the vaccine, also continue to keep that in mind, follow the SOP until you get the second dose,
Exactly.
isn't it? Exactly. So here, is there a need to provide documents to register and avail vaccine? And did you get a proof of vaccination? Or was that SMS that you are being vaccinated was proof enough?
Now, with the rollout of the health workers and the frontline workers being vaccinated, all we did was register our names in the portal with a photo ID.
Okay.
So once that is done, the beneficiary is automatically informed as and when the time and the place where the session will be. Yeah. So proof of photo ID will be mandatory.
Any photo ID?
Any photo ID.
Will do.
Any
Okay,
photo ID.
okay,
Yeah.
okay. Okay, so is there any other protocol set for people after receiving the vaccination? Because I hear that people who have taken the vaccination, they were asked to stay back for 30 minutes.
Right,
What
right.
was that for?
Like in any session site immunization setup, like we have an observation room.
You're smiling because I'm asking so many stupid questions.
No, not actually. These are very relevant questions, actually.
Yes, but we have the curiosity.
Right.
Okay.
So we have an observation room where after any vaccination, the beneficiary is supposed to wait in the vaccination room for 30 minutes. So we have health experts who will be there in the observation room, see if the person has any difficulties. Not only that, to see if the COVID protocols are maintained, and then give information regarding the medical officer or the A&M who is being who is vaccinating, or in case give other informations, like in case of small reactions to the vaccine, what to do when one goes home. All those informations are given.
Doctor, before we move on to another question, another stupid question, and I'm so scared of needles, and like me, there are so many people out there. Yeah, you're laughing. You must be scared of needles as well. We see the whole needle being, pushed inside the arm. Is it not going to prick the bone or something? Stupid. I know, but
not actually. See, this COVID vaccine, like it will be given intramuscularly. So you look quite muscular. It should be okay. So like. Of course, it will be given in right angles at the deltoid region.
I see.
Don't worry, it won't reach the bone. Our vaccinators are very experienced. They have been doing immunization since inception.
Yes.
So they say the vaccinator who injected me, I felt so comfortable while getting injected. I'm also afraid of needles.
Oh, okay. But you took the first step.
Right.
So, dear viewers, it's important to keep this things in mind. We ask so many stupid questions, but as laymen, as lay people, we don't know, and our curiosity, and that's why this evening, this program is basically to clear all these doubts. Otherwise, we are flooded with so much of informations through all the different platforms of social media, but hearing it from the official people here is important. So, jodi apni busy boy lage gole do, moi nisna bhi boy lage gole do, boy na kabe tahan ekta angle bra diye taki apnar laga hardy del lagibo ko ado chance nai aro etia mohan vaccinators kan do itu nutun vaccination dia ase itu bi noy ta poila bra vaccination alag bishi dia ase itu ana iman experienced nurses kan bra iman experienced manu kan bra he dia ase itu ana itu bui na khabi jodi moi nisna bui lagi thakise bole itu he kobole taka. Doctor, India recorded the highest day one vaccination globally, and that's a thing to be proud of. So at 64%, that's great. Now, I'm sure you're facing challenges here in Nagaland because there will be so many doubting Thomas like me out there in our society as well. So what is your roadmap following this now?
Day one on 16th, I should say, out of 180 of them got vaccinated. That's a good number.
Okay.
So definitely vaccine hesitancy was there among the health workers also. But as you and I get vaccinated, we go back and, we become good influencers. So likewise, we have our dynamic medical officers in all the planning units, all the session sites. So they in turn become influencers. So they go back and take back the good message, and then hopefully in due course of time, we should have lots of people coming forward to take the vaccine. At the moment, we started with 80, and as of today, around 1,200 health workers under Kohima district has been vaccinated.
That's a big number, and I must also take this opportunity to let my viewers know that my brother-in-law got vaccinated and there was no side effects. But I have this question, I'm going to put it to doctor. Side effects, adverse reactions of all these numbers of vaccination, takisina takyanai.
I will clearly say we did not have any side effects in all the 21 sessions we had. I won't even say it is side effect. I'll say normal reactions to vaccination. Vincent, like any other vaccination under routine immunization, when a child receives a vaccine, it goes to the body, it elicits an antibody response. And then it stimulates the inflammatory cells. That's how you get pain in the injection site. And then with the antibody response, you get slight fever. Those are normal responses to a vaccine. So this we had in some, Even me, I had some body ache, some lethargy, but with a little bit of rest, I'm fine. So
Okay.
this is expected. So I'll say it's normal response to the vaccine, not adverse event to the vaccine.
Okay. So dear viewers, keep this in mind. I don't know how well I'll be able to explain. Holibi ekta janibole lagya do mohan moidu baba ekta ase. To na moila bacha khan ke injection lobole jadem de ekta vaccination, universal vaccination. Aro itu Sunday devi hola ase ne kya?
Yes, we are having the IVPI.
Aro hobola ase.
Pulse polio.
Pulse polio bhi hobola ase. Of course, we are talking about vaccination, but vaccines kitya bhi bacha khan ama khan bal bra jani thakibo baba khan to loi na jai bishi bakt. But I know there are some good people, husbands who go accompany their wives, mothers for vaccines. Bacha ke injection diya dem de ekta bimar hobole olop bukhar hua ana khandu thake ole itu reaction no hoy koi doctor khambra itu matlab tu vaccine tu kam hoy ase kwa etu garne etya khushi ekta padu etya Kohima district te vaccination corona la vaccination iman dia de enega adverse reaction enega do ekta bi nai itu hunikne bishi khushi pa ase aro normal choto moto olop kiba hwa do itu tu taila kam hoy ase vaccine tu kam hoy ase itu ase do ne boi na khabule lage eta moi bi mon dangor hoy ase aste aste but suppose a person gets adverse reactions, then is there a protocol for treatment made available by health department?
Yes. So like we have the observation room. First of all, we have the observation room where the person is observed for 30 minutes. So at all levels, we have AEFI committees. We call it committees with respect to adverse event following immunization.
Acha.
So all the places, glad to inform you that all the places under Kohima district where sessions are being held, those are planning units where doctors are present. So each of the planning unit are AFI centers.
I see.
So even in the session, anaphylaxis kit is given, where the nurse present there is well trained as to how to use the kit.
Okay.
Even at the center where the doctor is present, AFI kit is given.
Okay.
And the doctor is well trained to handle if any situation.
Acha,
Likewise, we have AFI committees at the state level and also at the central level.
So it's very important to keep in mind adverse reaction itya top to report hua nai hoi corona vaccine kam hua laga itu khandu sign to lop to hoi hole itu pura bia reaction hoise naga to ekta bi hua nai jodi naga komba hoise kole bi itu ge sabole garne doctor khandu sub ready ase itu mohan jani bole lage doctor some quick questions itya eta kiman vaccine ase itu ha moi hudibulo mon nai hole bi immune compromise na jodi ekta can immune compromised people receive COVID-19 vaccine?
Okay, for this question what we need to be very clear is an immunocompromised person may be immunocompromised because of some disease or because of some drugs, immunosuppressants which they are using.
Yes.
So like if for example a disease attacks an immunocompromised person, so adverse event due to a particular disease could be higher in that person. The fact cannot be denied that when vaccine is administered, the antibody response of that immunocompromised individual will be lesser than a normal person.
Okay.
However, some protection is better than no protection at all. So an immunocompromised individual is very much eligible for the vaccination.
I see.
Yes.
I see. Okay. So can a person having normal cold and flu or fever get vaccination?
Yes, definitely. One can get vaccination. Some of the clear guidelines who the persons who are not to receive the vaccinations are like you said, those below 18 years, those pregnant women, lactating mothers. If anyone has had an adverse reaction to the first dose of COVID-19, if anyone had adverse reaction, maybe allergic or anaphylactic reaction to any vaccine in the with a past history of allergy to any vaccine or any pharmaceutical injectable products.
Okay.
Another thing I would like to stress is if someone is very seriously ill, terminally ill, hospitalized in the hospitalized, then the risks and benefits needs to be weighted.
Yeah. Doctor Manu Najanadam the personal ekta hodibuni.
Sure.
Idu allergy reaction ko adam de moi do bishi bhui lagise. Moi bi allergy reaction. I just have a cold allergy. I don't have any history of any medical allergy. Chuli buga hogina dai kura bi allergy nai. Hoile bi bishi thanda hoise bola ekta allergy ahya aro nostril do hoise river nisna flow kore sneeze kore to anaga type khan do marili bi covid na hoine ki to ita do
we have a very good living example, our chief medical officer who is somewhat similar to your case. She's also allergic to food. She took the vaccine. She's all fine, no problems, no issues. So here what we need to understand is the technology with which the COVID vaccine is being made. So like it's an adenovirus vector. So it takes the spike protein to elicit an antibody response. So these are, even the Covaxin and the Covishield, these are, killed viruses, which has, which is not a new technology. It's used in diphtheria, pertussis, tetanus, many of the vaccines which we are using in our children.
DPT koi thaga do.
Yes. So it's not a new technology. So
doctor quickly.
Yes.
Time polai.
Okay.
Bacha buki thaga, pregnant,
yes.
aro bacha doodh khilai thaga, na lactating mothers kan vaccine lo la paru na paru.
For pregnant women and lactating mothers, for the timing, the vaccination is to be deferred, is to be halted, because we haven't had data as such till now to prove that it is safe or not safe for pregnant and lactating mothers. But in the due course of time, I do believe that such a time will come when pregnant and lactating mothers can receive the vaccination also.
So diabetes, hypertension, asthma, and that vaccine lo na no lo.
Okay. See, Government of India is introducing the second phase of vaccination for those above 50 years. So the logic behind is more than 78% of the population with comorbidities, diabetes, hypertension will be covered. So suppose, the unpredictable nature of the virus, when it infects you and I, we don't know what will be the turn which the virus will take on us. So, it's better to get the vaccine, get protected instead of getting sick and get protected.
Okay, I think that proves the point. Probably last few 1-2 questions again. COVID-19 positive hoigine thaka nohole bi COVID-19 pra recovered hoise to tai vaccine lole paru na paru.
Okay, suppose if I know that my status is positive, or if I feel that I have symptoms, then I go to a session site, and then I put the other people at the session site at risk from being exposed. So that is the only reason why, if COVID-19 positive or if one has symptoms, one has to defer the vaccination 14 days from the time of symptoms.
Yeah. So last question hai koi loboi ta bishi ase holbi time bi pola ase, but last question do vaccination itya hisab te do for the time being we know that we're going to get 2 doses.
Yes.
Is it going to be effective for lifelong? That sounds quite sarcastic, but yeah, what is your comment? The
best tool to fight the pandemic, I should say, is vaccinating and also using the COVID protocols. Vaccination will protect you when you are exposed, and following the COVID protocol will prevent you from getting exposed. So 2 tools used together, I'm sure will protect you for a lifetime.
Okay.
So the vaccine, the logic here is the vaccine is being introduced just now. So the long-term efficacy of the vaccine is yet to be studied.
Okay. Doctor, any final message to our viewers? Any last thoughts?
Be responsible, join the race, global race,
Mm-hmm.
to end this pandemic by vaccinating yourself, following the COVID protocols, and protecting your loved ones, protecting yourself and your loved ones with comorbidities. Let's all take part in the vaccination process, create a 75 to 80% herd immunity,
Okay.
and then defeat this pandemic, which has been
Yes.
really disturbing us for the last 1 year.
Yes, indeed. Doctor, thank you so much for sparing your time, coming to the studio, talking to our viewers. And we believe that the mission that the Health Department of Nagaland that you have in hand, and particularly with dynamic CMO leading you and an expert like you leading the way, I'm sure we will be able to defeat and have many more people coming in for vaccination. Thank you so much for giving us your time.
Thank you, Vincent. Thank you.
Well, viewers, we have many questions, many doubts, and many queries, and I say that is normal. But it is important to get the correct information, authentic information, and not rely on information that floods our social media pages these days. So I believe with this little interaction with Dr. Rupert Peseye, I believe we have come to understand the necessity for us to follow the SOP, COVID-19 SOP, and also the importance and vitalness about getting the vaccination. For those people who are getting the opportunity now, get yourself vaccinated and help the others to stay safe as well. Thank you so much, and bye for now.